Conversations podcast.
Hello, everyone, and welcome to another episode of Conversations Interpreting and Translating podcast. Before we start, I'd like to respectfully acknowledge that I am conducting this interview on the traditional land of the Wurundjeri people of the Kulin Nation, and I pay my respects to the elders, both past and present and future. Now, today I'm very lucky to have with me Yue Hu, who is the Director of the Transcultural and Language Services at Northern Health. Hello, Yue. How are you?
How are you? Nice to meet you, Fatih.
Very good, thank you. I'm also very good, and I was very lucky to meet you in person last week. We had a brief chat at one of our lectures a few weeks ago. But we had a chance to finally let our hair down and have a couple of glasses of wine at an event last week. It's that particular event that I'd like to talk to you about today. It was June 3rd. We were at the reception for the Centre for Cultural Diversity in Ageing's Excellence Awards. And what an excellent night it was, actually, wasn't it?
Definitely. That was my first on-site event after a while. It was quite enjoyable.
It was a lovely night. So after, I think, being postponed for about 4 times due to COVID restrictions, It was finally able to go ahead. And I just want to send a big shout out and a thanks to Lisa Trebuzio, who was the manager at the Centre for Cultural Diversity in Ageing, and her team for putting on an amazing night last week. So thank you very much for the team there. At that event last week, Northern Health actually won an award. So congratulations. You won the award for excellence in organisational leadership.
Thank you. Yes, we won an award. We were one of the finalists in the event, and we were very excited about it.
And while we're at that, probably give a big kudos for other finalists as well, Bolton Clark and the Australian Multicultural Community Services for their services to the aged care industry as well. So a big shout out to them too. Yue, what was this award about? So what is the excellence in organisational leadership? What did Northern Health Transcultural and Language Services do to win this amazing award?
I think by receiving this award, it is a recognition of all the service Transcultural and Language Services Department has been doing over the last 15 years. We started from a very little team, only 4 people. Coming today, we have 46 in-house interpreters, plus a bookings admin team and 2 managers. So we've come a long way in the last 15 years in leading this organization's cultural change, in providing culturally competent care to our consumers coming to the service.
And well done again for such an achievement. In particular with aged care, which is the focus of the Centre for Cultural Diversity in Ageing, what services do you offer for the aged care sector at Northern Health there?
A large portfolio of what TALS have been doing is to provide cultural competence training to the organization, in educating the clinicians and everybody about why we need to provide culturally competent care to our patients, why we need to engage them directly by making them feeling safe in attending our service. So that is very important when we speak with our patients, when we want to engage with them. A lot of the times when we are not engaging our patients directly, we are losing that opportunity. We are losing that chance to hear what they really want to say. And we were been trying to maybe I would say find excuses for ourselves not to do that. Sometimes we would say it is too hard to find an interpreter. Sometimes it is just very challenging to communicate with these people, not understanding their cultural needs, not understanding their background, or it is just too hard to trying to understand each and every culture of all the patients, of the way they're coming from. And on the other hand, some people, some clinicians, they are so keen to talk to these patients to understand their cultural needs, that they would approach experts like us, approach libraries, lectures, and books, trying to find the answers. But what we are trying to tell them is, you just need to talk to the person in front of you. Forget about all of those theories behind you, all the knowledges that you learned by traveling all over the world in understanding each culture. The best strategy is just to talk to the person in front of you, because on the other hand, we don't want to stereotype as well. We don't want to put people into boxes because I have understood that culture. I think that's what TALS has been doing in the last 15 years by constantly giving lectures around the organization to each department to approach them and tell them the importance of engaging language service when you are trying to engage a patient. Because we know you want to provide a good care for the patient. No one would just come to work and just make that decision. I'm not going to provide a good care today for my patient. No one wants to do that. We all have good intention when we come to work, but we all know hospital is a very busy environment. Sometimes you just don't have the time to be able to do everything you wanted to do. Doesn't matter whether you are providing care for a patient attending a clinic appointment or a patient has been admitted in the ward. Everybody wants to look after them with the resources that we have been provided. So that's the value of having the in-house team. We now provide close to 80% of the language services demand in-house. The rest will go to the agency. Yeah, by having this large in-house team, I think we also give the confidence to this organization that they can access the language service they want at the time they want, because we have such a large coverage.
You make an amazing point there, because it sometimes healthcare professionals, for them it's just easier to use a family member, because getting an interpreter is going to be taking too long. They have to book, jump through a lot of hoops. I mean, it's not a lot of hoops that they have to jump through, honestly, I guess, but for them, because they're so busy and they're seeing so many patients every day, it might just seem like it's easy to talk to that family member instead of talking to the person directly with an interpreter. But to have such a big in-house team like the Northern, and the healthcare professionals knowing that they can have access to pretty much any interpreter that they want, whenever they want, and also with you and your team educating them about the importance of using interpreters constantly, I think makes a big difference, wouldn't you say?
Exactly. And the mindset change that I mentioned before is also to see interpreters as part of the team, part of the caring team, together with the clinicians and anybody who works in the hospital. So having an in-house team will help with that as well, because interpreters are considered staff members working in the hospital together with the clinician. So it helps with that mindset change. Before, if a clinician see an interpreter as a helper for the patient, then it will, if I am a clinician holding that thought, probably it would be less possible for me to see the interpreter as part of my team, that I need to engage this interpreter to provide the care that I want to provide to the patient. So by having in-house interpreter working in a team with the clinician, I think that helps the clinician to have that shift of mindset as well.
Definitely, if the clinician knows that the interpreter is there as part of the healthcare team, just like nurses and radiologists, everyone that's working at the hospital, interpreter is a part of that team, and it's a collaborative approach for the healthcare and the well-being of the patient, isn't it?
Exactly. When speaking of aged care, looking after elderly patients, during COVID, we know it has been a challenge for everybody. So we have been very lucky that we have a in-house team, because at the beginning of the COVID, we have been providing PPE training for our interpreters. We have been adopting all the safety measures. We have scaled up our workforce at the beginning of the pandemic. And during the whole process, I think we quickly shifted our workforce from a purely face-to-face interpreting team to a very diverse team. We provide telephone service, we provide video service, We provide all the trainings to our interpreters for them to be able to change the way they deliver their service as well. Also, because we are part of the hospital workforce, we are looped in the communication of all the COVID information, of all the safety training and everything. So we are confident when we attend a on-site service in the aged care facility, we have all the gears and knowledge and skills to be able to conduct our service on site. If we are not able to do that service on site, we can quickly shift that delivery type to video or telephone, and we have a good admin team to help with that shift very timely as well.
Now, I know that at Northern Health, and I had a chat to your predecessor as well last year. Hello to Emiliano here, and congrats on his new position at the ECCV. And I know how Northern Health is a very innovative organisation there with the TALS department there. Now, one of Australia's best innovations, I think, over the last couple of years, and it was Australia's first, I believe, virtual emergency department that the Northern Health launched, right? Can you tell me a little bit about that? Like, was that just because of COVID, or did you have those planned and then it just happened to coincide with COVID? It's an amazing service. Tell us a bit about the virtual ED.
Yeah, it is a very interesting service. It was Australia's first virtual online emergency department. Initially, it started from an idea of one of our doctors in ED, and she created this idea into virtual ED as what we are seeing today. Now, virtual ED has gone statewide. Northern Health is now providing virtual emergency service to not only people in the Northern Health catchment, but also to all Victorian.
Oh, wow.
Yeah, to all Victorian residents.
Is it the only hospital offering virtual ED at the moment, or are there other hospitals that have caught on to this?
At the moment, it's Northern Health, the only public health service providing the virtual ED service. Yes.
Wow. Go Northern Health.
Yes, it is an amazing initiative. Yes. So what we are doing is we are using the Health Direct platform, which is the platform for all the telehealth consultation via video. Any patients who would like to see an emergency physician or a clinician, they can hop online by scanning a QR code or click on the link. After the registration, they're being put in a waiting area virtually before they are seen by an emergency clinician.
And can they have access to an interpreter as well?
Yes, definitely. They have access to interpreters as well. They can tick when they are doing the registration to say they need an interpreter. So the clinician will help them to find an interpreter.
Wow, that sounds amazing. I know that this is quite a new service, but I could only imagine that it would take off a lot of pressure from the actual in-person emergency department, wouldn't it?
Exactly. We don't have a specific data about that yet. However, what we are seeing is it's not only reducing the waiting time of the actual emergency department by triaging these people to virtual online service. It is also a new service that is provided online for everyone to have access to, regardless of where you are. A couple of us already access this service. Even some of our interpreters have tried this service, and they say it is so convenient. You can hop online on any of your devices at home. So the wait time is not that long before you can speak with someone online. For non-life-threatening conditions, it is definitely something you would feel confident to access.
And whether or not it's life-threatening or non-life-threatening, I guess that's found out through triage, right? I mean, you're still seen by a triage nurse, and then that nurse might say, "Oh, actually, come to the hospital right now."
Yes, exactly. Yes, yeah. And of course, if you are experiencing life-threatening situation, you should always call 000.
Always call 000 if it's a life-threatening situation. Anything else, jump onto the virtual ED portal of Northern Health, who is now providing their virtual ED services in all of Victoria. You guys are into research there as well. What kind of research is happening at Northern Health these days?
Yeah, I might go back to what we do, what we call it a TALS model. So we provide interpreting service without saying. We have a large demand. We cover over 60,000 interpreter bookings per year.
Wow.
And as I said, 80% of them are covered in-house. We also do translation. So every year we translate more than 300,000 words in our top 8 languages. We also do transcultural training to our 7,000 staff members at Northern Health every year, covered in their online training. And the last part of what we do is research. So to date, thanks to Emiliano as well, we have published over 30 national and international conference papers and articles. A lot of the research that we have been doing is about what language service is changing the way we care for our patients and what the benefits are. Also, we are helping with the researchers in the organization to engage our CALD community into their clinical research. At Northern Health, we have a policy that 25% of the participants in any research project needs to come from a CALD background. It's very interesting. We see a big change in what we call post-COVID era change. People start to approach us more when they are doing research, when they're trying to engage consumers in developing, for example, patient information brochures. Information videos is another thing people tend to develop these days.
So you're consulted during that process, are you? It's a co-design, so you're actually involved in the creation of this content, are you?
I would say it's a bit of both. What we have been doing at Northern Health in developing patient information has been, we are engaged in the consumers group. So at Northern Health, we have a consumers group in giving feedbacks to all the health literatures they're producing to the patients. So TALS has always been part of that group to give culturally advice, to give advice regarding to the culturally appropriateness of this material to this group. So that has been part of the co-designing process.
That's amazing.
The patient information brochures. Yes, now we have the video content. Also, because people now tend to develop digital content.
That's right.
To send to the patients. We are now seeking governance in that area because this is also something new for the healthcare industry in developing this video content to the patients. As I said before, it's all well intended. The clinicians, researchers, and everyone, they do want to engage with the CALD community. We are just helping them we're just helping them about this how to engage them. So these days, as we mentioned, social media, we are all living in some sort of information bubble, I would say, especially for people who do not have a good command of English. We're very used to keep receiving information from the media in our own language. So that is definitely creating some sort of information bubble for us all. So I would say by accessing information directly from a health service in regarding to your own care, sometimes probably would be the only chance you are trying to get information from another channel outside of your comfort zone. So by having that information translated and delivered in a way that you feel comfortable with, makes it invaluable for you to receive that crucial information for your own care. So I think that is also why providing this service is so important to our consumers. Not because we want to look after them and teach them and tell them and preaching to them, but also we want to engage them and want them to be part of the care we are providing to them.
Wonderful. Thank you very much, Yue, and I really appreciate your time today. I know that I'm talking to you during your time off, so I really appreciate you jumping online with me today. And I do apologize for taking you away from your family time.
Don't worry at all. It's been a while that I haven't taken my leave because it's just very busy in the hospital. We've been trying to keep up with everything, do our best as we can. Try to cope with the constant changes.
That's right.
So now we're still in a lot of the restrictions. We are still wearing our N95 masks in clinical areas plus face shield. We're still not allowed to have on-site events, for example. That's why I said last Friday's event was very exciting for me.
Definitely.
Definitely. But I just wanted to say COVID is not over yet. We're still in the midst of it. And the healthcare workers, we are really working hard trying to combat with COVID and look after our community. So as for our interpreters, they're the same. We are now trying to extend our PPE training, our fit testing and everything to our agency interpreters as well, not only in-house interpreters, because we believe regardless of what your employment status is, we all want the clinician to see you as part of the caring team. And sometimes you can see the change from the clinician by having a really good interpreter. Just one session can change everything. So I would say it's a joint effort by everyone. Not only the educators need to provide the training to clinicians, not only management need to go out and liaise with other departments and tell them the importance of engaging interpreters, streamline the process, but also interpreters plays a crucial part in the process because we are the person who is there in the team, delivering this mission together with everybody else and make a difference to the person that we're caring for. So I need to give the kudos to all the interpreters who are listening to this today. You are making a difference to our society, to our community.
So well deserved. So I hope you were able to let your hair down a little bit and have a bit of fun, hopefully.
Yes, definitely. I finally get to catch up with some of my friends for dining. They haven't done that for a while. And going tomorrow, our family has booked a trip to Geelong. We're going to stay there for 2 days.
Nice. Well, enjoy your stay. Geelong's beautiful. They got a lot of galleries there. The shoreline is beautiful. So enjoy your time.
Thank you. Same to you. Have a good long weekend.
Thank you very much. Thank you very much to all of you out there for tuning in today as well. I spoke today with Yue Hu, who is the Director of the Transcultural and Language Services, otherwise known as TALS, at the Northern Health. And congratulations again to you and your team for taking out the award for Excellence in Organisational Leadership at the Centre for Cultural Diversity and Ageing's Excellence Awards on the 3rd of June. Thank you everyone again for tuning in, and please don't forget to like the video and subscribe, and we'll see you next time. Thank you.
Conversations Podcast.